This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Well, tonight I might talk about male infertility. It's a little bit something that's not discussed a lot, and I think most fertility specialists actually don't deal with it particularly well. Not so much, not just diagnosing it, but actually helping men come to terms with the fact that their sperm is the reason why they're not having children. So there's some data just come out this last week, the Australian New Zealand ART data, which is collected from every IVF cycle from every clinic in Australia and New Zealand on an annual basis. The 2020 data was released, and for the first time, information was collected that related to male fertility. In the past, all there was a box that why you're having IVF, and the box got ticked. Male infertility. What we've done with the help of the Andrology Australia organisation, and in particular Professor McLaughlin in Melbourne, is put in a series of questions to try and look more at what constitutes male infertility as a reason for having IVF. In addition to ticking the box male infertility, which in about 40 to 50% of cycles done in Australia, the box was ticked. Now, about 30% was male alone, and in the other 20% was a combination of female infertility as well as the male infertility as a reason for having IVF. When the data was pulled in relation to the causes of the male infertility, there were 3 or 4 categories that could be ticked, some of them more complicated, rarer conditions, as well as unexplained. And the interesting result was that 75%, 3/4 of men who have poor sperm counts as part of their IVF journey, 75% cause was ticked as unknown. And that sadly reflects where we are scientifically in relation to understanding why men might have low sperm count. So the thoughts are, why is that so? Because on the female side, it only ends up being around 15 to 20% where we go, we don't know the answer. On the male side, it almost certainly is that we don't understand the genetics that are involved in sperm production. We have some idea. There is a group of what are they called microdeletions, so absent pieces of DNA on the Y, the male chromosome, are present in around about 15% of men with very low sperm count. So we do know something, but for the remainder, we really are still struggling to work it all out. In relation to the other 25% in which boxes were ticked, they were fairly expected things like blocked tubes, although 11% of male infertility was due to the man having a previous vasectomy. At one point in his life, he wanted to be infertile and now has found a new partner and they want to have babies. And so getting around the vasectomy was the reason for having ART. In that sort of scenario, what we can do is put a needle into the testicle, because there are sperm there and they're still being produced even though you've had a vasectomy, and suck out 3 dozen sperm from the testicle and then be able to use those to inject the eggs to produce a baby. So, but other causes of blocked tubes leading from the testicle are, there's a tiny group of men who weren't born with the tube, the absence of the vas it's called. And we know that has a genetic origin because it's associated with the cystic fibrosis gene and mutations of the cystic fibrosis gene. Again, there's sperm in the testicle. We can aspirate the sperm and create a pregnancy that way. Rarely these days you can have infection causing blockage. The gonococcal infection was the one most common in that regard. And I think in 20 years I haven't seen a blockage due to infection. So it's not the common. Investigation usually involves an ultrasound of the testicles for 2 reasons. One is that the testicle, a low sperm count, has a higher association with a tumour a cancer of the testicle, seminoma. So it's important to exclude that as a possibility when we have a poor sperm count. In addition, it gives us information about the size of the testicle, which again can give us a degree of hope about the prognosis of improving the count. If you have very tiny testicles, like little hard marbles, the odds of finding sperm ever are very small. But if they're normal size, it's likely that there'll be some sperm somewhere. We also do blood tests to look at the hormones that are made in the brain to tell the testicles what to do in terms of sperm production. The things that can alter those pituitary hormone levels are basically those things that switch off the pituitary. Stress can do that. I've certainly seen men who are in a very stressful job who have low sperm counts and their hormone levels in the brain are low. It's a bit like in women whose periods stop when they're studying for exam. The pituitary hormones have been switched off by the stress. They can also be switched off by taking drugs. So in a woman, she can switch off her pituitary and therefore not ovulate and therefore not get pregnant by taking the contraceptive pill. That estrogen switches off the pituitary. In a male who takes testosterone, the same events occur. It switches off the pituitary gland and therefore switches off sperm production. And sadly, I'm increasingly seeing young, buff men turn up in the clinic with their wives with low sperm counts or absent sperm count. And when we ask them the questions, they admit to using supplements at the gym. The guy at the gym has said, it's all right, it's good, it'll make you stronger, better looking, more buff. And if they then ask the question, what about my fertility? They get reassured that it can be reversed. It's probably true to some extent in the majority, but there is a small group that will never return. But more importantly, that return takes 6 to 9 months on average. And when you're wanting a baby yesterday, most women are not very impressed that their husbands have been taking these supplements. There's going to be some time before the sperm comes back.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.